I gave a presentation to at CAMO, which is our Canadian Association of Medical Oncologists meeting. This is probably about 18 months ago now, and they asked me to talk about physicians as advocates and how you can get involved. And I guess I was in a funny mood at the time when I was preparing my talk, because I was a bit fed up with regular talks. So I put up TV shows and movies for all of my slides, and each TV show or movie was meant to illustrate a point. And I don't know if you've seen the Squid Game, but the Squid Game was the slide I put up as my example of this process, because you can, in the Squid Game, for those who haven't watched it, you start with, like, I don't know, 100 people, and they go through these versions of children's games, but you die. Like, if you don't pass the test, you die, and then one person's left living and wins the prize and the money. And I kind of made that comparison, that the process is, you can die at Health Canada, you can die at PCPA, you can die at the HTA process, you can die at the provinces, and we've got examples of all of them. So yeah, it's a bit like the Squid Game.
Yeah, no, it's this for this podcast, we've actually delved into this process a couple of times, and actually we had a poll that we actually put out on LinkedIn a couple of months ago, just to see, like, if people could get the order right, like what was necessary. And I think actually, well, it's kind of a biased audience, so the people tend to be quite educated in this matter that were answered the poll, right? So quite a few people were able to get the answer right. But I think it does surprise a lot of people, especially a lot of my friends in the US, who think, oh, you're a single payer system, right? That should be super easy, right? And they don't understand that, oh, there's actually this many steps, arguably even somewhat more complicated than, say, the US, because in the US, actually, the vast majority of cancer patients actually are really funded through Medicare, right? The insurance that pays for it is usually through Medicare. So for them, they just go through basically just Medicare, and that's like 60% of the population.
And Lester, Medicare and Medicaid, unless this has changed, as soon as the FDA issue an approval for a drug, Medicare and Medicaid will pick it up. So it's very quick. In the UK, the HTA, or Health Technology Assessment Body, is nice, and their recommendations are binding. So the cost negotiation goes along with it. And so it is frustrating to have all of the steps in Canada. And at the minimum, it might make sense to say, why don't you put the HTA process together with PCPA? And so if our Health Technology Assessment Body is going to recommend approval of a drug, then we know that we're then going to get it. And that the funding is, negotiations are sort of built into that. And I think we will probably accept that. And I think also, while I'm a lung cancer oncologist, and I might say, look, I want every lung cancer drug available, I want all of the options to sit down with my patients to talk about. Of course, I want all of those options. But we're not immune to the world around us. And we can all see, we're in 2024. We're talking about, like, cost of living crisis and inflation, and then we look in healthcare, and we see all of the other needs in Canadian healthcare right now, whether it's a shortage of family doctors, or it's pediatric mental health, or it's elderly care needs. We're not immune to the fact that everything's got to be paid for, and so we can't necessarily get all the toys, but it would be nice to be a little quicker, a little bit more predictable, for us and for companies as well, so we can, so we're not sort of left hanging, we're not left angry when there's sort of an injustice that we perceive. So yeah, it's frustrating. But as somebody said to me once when I was getting into the advocacy world, and actually I put up a TV show for this as well in my talk, but it was a show called Lagan, I don't know if any of you have seen that. It's a Bollywood movie about cricket. And the movie itself is about 4 hours long. And cricket is a game that in its best format takes 5 days. But so I was talking about, when you're in advocacy and we're working for these changes, we are in for the long game. We're playing the long game. We're not going to get discouraged by one setback. But we just got to keep plugging away.